Hi, this is pharmacist Curtis Alexander. In this video, we're going to talk about Atorvastatin. This is part of our 101 series where we're taking medications, supplements, and breaking it down basically from a 35,000 foot view level to give you as a consumer an idea of what you're taking or what you might be taking. You can talk intelligently to your doctor and both have a good conversation about what things are entailed with this particular medication. Before we get into it, I'd appreciate a thumbs up if this video was helpful, and also subscribe if you want to see more videos from a pharmacist about medications and supplements. And so let's hop right into it. So again, we have Atorvastatin. Now, you've probably heard of it because it's one of the most popular medications prescribed in the US, but it's used to decrease cholesterol levels, and it's part of a class of drugs. MOA is mechanism of action. It's part of a class of drugs that inhibits an HMGCo-A Reductase inhibitor. Fancy way of saying there's a liver that is one of the rate limiting steps in synthesizing cholesterol in your body. So when you block that enzyme, your body can't make cholesterol the way it used to, and that is where Atorvastatin acts. It's blocking that enzyme so cholesterol will go down. Now, I don't want to get into whether that's good or bad. That's a conversation for another time. And the whole cholesterol theory of medication or cholesterol theory of heart disease, you know, there's some good points out there about why that maybe isn't the right way of thinking. But again, back to Atorvastatin, that's how it acts in the body. And this is a class of medications that's commonly referred to as the statins because they all end in the moniker statin. You have Atorvastatin, simvastatin, so that class of drugs. Now, as far as CI, that's contraindication, people, groups of people that we cannot use it in. The first one, if you have liver disease, it's one that they're not going to want to use in you. Also, pregnancy and breastfeeding, it can't be used in that case. Now, I want to spend a little time on the dosing. It comes in a 10 to an 80 milligram strength, and those are your most common dosages. I will point out that dosing at an 80 milligram strength is pretty rare. You tend to see 10 to 40 milligrams. You tend to see the dosing at bedtime because that's when cholesterol synthesis is at its highest. Most people, when they start, you can begin to see the cholesterol levels going down within a couple of weeks. That's not always the case, but it's a good rule of thumb. 2 to 4 weeks, you should be able to see if the cholesterol levels are going down. Now, as far as side effects, it's pretty well tolerated, but I'm going to spend some time talking about one of the more serious side effects here in a second. But some of the more common ones and not as serious tend to be diarrhea, 7 to 14% of people. Some people can pop up with a cold-like symptoms, tends to go away after a while. Limb pain, 9%, and muscle pain, 9 to 12%. Now, I want to spend a little time on this muscle pain because you do want to pay attention to that if it starts cropping up. There's a side effect called rhabdo, or the technical term is rhabdomyolysis, which is essentially breakdown of the muscle. But when that happens, it can become toxic to the body. It can actually become lethal to the body. So if you start to experience any sort of muscle pain, that's something you want to pay very close attention to and let your doctor know about it right away so they can keep a close eye on you. Again, I don't want to scare anybody with that, but if rhabdo does happen, it is serious. It can be lethal. So it's not something you want to mess around with. Keep an eye on that. Interactions, the other important thing about Atorvastatin is that it's metabolized or broken down through the CYP3A4. It's an enzyme system in the liver. Now, because it's broken down that way, we have to watch its use with other medications that interfere with that enzyme system. It's a very common one for medications to be metabolized by. So any inhibitors of CYP3A4, we have to be careful with. Those include some of our antifungals. Fluconazole would be one. Those include HIV medications. They include some blood pressure medications. Again, I always tell people, if you have questions, you have to go to your pharmacist that's dispensing your medications. Just ask them to run a drug interaction check. They'll be able to do that and let you know if you're at any sort of risk with these. I touch on this in almost every video because it's a really common question. People ask about weight gain and hair loss. That's two big things. So as far as Atorvastatin, it has been reported to cause both weight gain and hair loss, but the rates at which it's been reported is really low. So I mention it in passing, but it's not something I would take serious. But again, it has been mentioned. Now, at the beginning of the video, I forgot to mention, I like to just kind of give you my big takeaways for these medications. So Torvastatin, again, very popular. We have a ton of evidence for its use. Now, whether lowering cholesterol is the right way to go about the heart disease issue, there's a lot of debate about that, and I don't want to get into that. But as far as popularity, tolerance, it's good. We do want to keep a very close eye. It's tolerated well, but if rhabdomyolysis, the rhabdo pops up, extremely serious, something you want to take very seriously. So any sort of muscle pain that crops up, let your doctor know. And like I said, tolerated well, very popular. So I hope this video was helpful. Again, if it is, give me a thumbs up, subscribe to the channel, and comment below. Have you taken Atorvastatin? Know someone who did? You know, how did it fare? How did it help them or not help them? I'd love to know. I'd love to read the comments. I'll do my best to respond to them. Again, until the next video, Pharmacist Curtis Alexander, thanks for your time.